Preparation before the test. Wash your hand with soap and water for at least 20 seconds before the test. Read the instruction for use, IFU, carefully before taking the test. Check all kit components are present and have not been opened. Take the extraction tube and place it in the tube holder marked on the box. Peel the foil seal off the extraction tube. Sample collection. Remove the swab from its packaging. Gently insert the swab 2 to 3 centimeters into your nostril until you feel resistance. Slowly rotate the swab at least 5 times for about 15 seconds. Remove the swab from the left nostril and insert into the right nostril. Again, rotate 5 times for 15 seconds. Place the swab into extraction tube liquid. Rotate the swab tip against the wall of the tube vigorously at least 10 times. Break the swab by bending it at the notched point and leave it in the extraction tube. Close the nozzle firmly onto the tube. Squeeze the tube around the swab tip at least 5 times. Take the cartridges out of each foil pouches and place it on a clean flat surface. Hold the extraction tube above the sample well. Squeeze gently so that 2 drops fall into the well of RAT-19A cassette and repeat it for RAT-19B cassette. Set a timer for 15 minutes. Read the result between 15 to 20 minutes. Do not read the result before 15 minutes and after 25 minutes. Result interpretation. If C lines are present for both cassettes and a line for RAT-19A is present, the result is positive for influenza A. If a faint or weak line is observed, it should be interpreted as positive. If C lines are present for both cassettes and B line for RAT-19A is present, the result is positive for influenza B. If C lines are present for both cassettes and S line for RAT-19A is present, the result is positive for COVID-19. If C lines are present for both cassettes and T line for RAT-19B is present, the result is positive for RSV. If C lines are present for both cassettes and A and B line for RAT-19A are present, the result is positive for influenza A and B. Co-infection is rare but possible. If results are positive for more than one antigen, please do a retest. If C lines are present for both cassettes and A and S line for RAT-19A are present, the result is positive for influenza A and COVID-19. If C lines are present for both cassettes and B and S line for RAT-19A are present, the result is positive for influenza B and COVID-19. If C lines are present for both cassettes and A, B and S lines for RAT-19A are present, the result is positive for influenza A, influenza B and COVID-19. If C lines are present for both cassettes but no line is present at B, A, S in RAT-19A and T in RAT-19B, the result is negative. A negative result indicates that there are no COVID-19, influenza A, influenza B or RSV antigen present in the sample. Please do a retest after 24 to 48 hours if you experience symptoms. If symptoms persist, consult a medical practitioner for follow-up clinical care. If no C lines appear for both cassettes, the result is invalid. Both C lines must appear in both cassettes for the test to be a valid test. Repeat the test with a new test kit and a fresh sample. If only one C lines appear in either RAT-19A or RAT-19B cassette, the result is invalid. Even if line appears at B, A, S, in RAT-19A, and T in RAT-19b. The test is invalid if both C lines do not appear. After repeating the test, if invalid result continues, please contact HA Tech customer support line for assistance. Place the used test in a small bag and dispose it in general waste bin. Wash your hands with soap and water. The test is completed.